Coming up today, medications managed her liver disease for decades, but eventually it was time to transplant. Why this survivor endured not one, but 2 liver transplants. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Glenda Meeker cherishes her health because she knows what it's like to be seriously ill. After seeking a liver transplant for years, she finally got one, only to need another. Here's Janine Keesley.
The sun shines down on Glenda and Randy Meeker as they ride their bikes, a favorite pastime they've reclaimed after years of uncertainty. Just a short time ago, Glenda was too sick and too weak to do anything.
I was so sick and so weak, I could hardly hold my head up.
For decades, Glenda battled an autoimmune disease that destroyed her bile ducts and led to cirrhosis. By late 2022, her health had deteriorated so much that she was in and out of the hospital, struggling to stay strong. Just when it seemed there were no more options, everything changed.
Insurance was saying it's time to let her go, and I was going to have to be discharged on a Wednesday. And Wednesday morning at 3:20 in the morning, I got the call that they found a liver.
The transplant gave her hope, but within months, her body rejected the liver.
Things just started going south again, and they determined I was going to have another transplant.
Glenda's hepatic artery had completely occluded, cutting off blood flow. Back in the hospital, doctors were monitoring her for a blood infection when, in an unexpected twist, another liver became available.
It was just so unbelievable that it just happened.
Through it all, Randy was by her side, determined to see her healthy again.
I needed her, and I needed her to get well, and I was going to... Sorry. I was bound and determined to do whatever it took, basically, to get her back.
Glenda credits the team at the University of Kansas Health System for saving her life and giving her back the life she loves.
Shout out to all of my doctors and my nurses that took care of me during this ordeal. I always felt important. I always felt like everybody knew me and everybody valued me.
Both of Glenda's transplants came from deceased donors, but she acknowledges the selflessness of those who consider becoming live donors.
I can't even imagine making that sacrifice, but I can say to anyone who's ever considered doing it, they would never know just how appreciated and grateful that the recipient would be.
Since her transplant, she's felt a transformation.
You don't realize just how unalive you felt before.
For Randy, there's nothing more important than having his wife back.
It's the love, knowing that I need to take care of her. I need to get her back. I need her. It was a process, and I'd do it again if we have to.
Now with each bike ride and every moment they share, Glenda and Randy embrace the gift of life, knowing just how precious it is.
And we are so happy to have Glenda with us here today. How are you feeling?
I'm feeling well. I'm very glad to be here.
Well, we are glad you are here with us, and we're so glad to have Dr. Ryan Taylor with us. He's a transplant hepatologist here at the health system. Across from me is Dr. Clay King, a transplant surgeon also at the health system. He's also Glenda's surgeon for her second transplant. Great to have both of you doctors here with us. Dr. Taylor, how great is it to have Glenda here sitting next to you?
It's amazing. She looks wonderful, and just so happy to see how much progress she's made.
Dr. King, what's it like to have Glenda here on the other side of her second transplant?
Yeah, I think it took a village. You know, I get to represent the surgery team and everybody, but it was a huge undertaking, and a lot of great people were there to help out and know more than the donor. That was the most important part, and I've kept pretty close tabs on Glenda and Randy. We've had some basically social visits in clinic in the last year. So yeah, they mean a great deal to us, and to see how she's doing today, see that video, it's pretty moving.
Yeah, Glenda, you said you're pretty close with this group. I take it.
Oh, yes.
Very much so.
Yes, very much so.
Take us back though to the original diagnosis 30 years ago.
Yes.
How did you find out that you had PBC?
Well, I found out really kind of accidentally. I had had an allergic reaction to a sulfa drug, and they were checking blood tests and specific liver function tests, and it came back elevated. They waited a little bit to repeat it and still came back elevated. I was referred to a gastroenterologist, and he referred me for a liver biopsy, and that confirmed PBC. I don't remember the stage I was at the time.
So, Dr. Taylor, I brought you in to help us explain PBC, but most importantly, how to pronounce it.
Yes. So primary biliary cholangitis is a type of disease, autoimmune disease, where your body attacks the bile ducts, which are inside your liver. And your bile ducts are special types of tubes that help drain bile into your intestine and help with digestion. But if you can't drain bile properly, it's corrosive and can damage your liver and can eventually lead to liver scarring.
So I guess PBC can be slowed down. Glenda, you were on a medication. What medication
Yes,
were you using?
It was brand name Actigol at the time. It's Ursidile. And it, like you said, can slow down the progression of the disease. It bought me about 20 years of good health.
And what were you feeling that made you realize, though, that your liver was getting worse, that this medication had kind of run its course?
One of the common symptoms with PBC is extreme itching all over, and obviously fatigue. And I was just having a lot more severe itching and fatigue, and I knew something was up.
So what was the conversation like when it was time to go on the transplant list? Did you know that conversation was coming?
Because it was a natural or a slow progression of things, and I had several years of intermittent hospitalizations with infections, and I'd begun to have ascites, which is accumulation of fluid in the abdomen that you have to have drained, also in my lung. And so after a period of intermittent hospitalizations and infections, it just became evident that things were getting worse and progressing to that point.
So you go on the list. A lot of people want to know, how long would someone possibly remain on the list? So how long were you on the list?
Well, the trick is you have to be sick enough to be be evaluated for the list. I was evaluated in October of 22 and placed in November, and then was transplanted in March of 23. So I was only on the list for about 4 months.
So this is where we talk about the MELD score, Dr. Taylor, kind of that I always say, kind of the hovering in between, sick enough to need one, but healthy enough to then receive one. How do you determine the urgency for people needing the liver transplant? How does the MELD score work? And of course, explain what that is.
Yes. So the MELD score is like your extra vital sign for patients with liver disease, and it takes 5 common blood tests, and you can put it into a calculator, and it'll spit out one number. And then that number gives us an idea of how sick the liver is, and then we use that number to rank order patients on a transplant list for severity.
And then does a MELD score change over time and fluctuate?
Absolutely. Anytime we check blood work, it can change. It tends to be pretty constant for people at certain levels, but as they get sicker, it will keep going up.
So put that into perspective. Like, what's a MELD score need to be? What does it normally hover at? Where does it need to be to get on the list and get bumped off the list and so on and so forth?
This number usually ranges from 6 to 40, and so the lower the number, the healthier the liver is. And as you approach 40, then we know the liver is much sicker. So most patients are getting transplanted around a 30 on that score right now here in Kansas.
So when Glenda's then ready for the transplant, that's when the conversations with Dr. King start to be had. Walk us through what happens during a liver transplant. What makes a liver transplant so complex, maybe as opposed to a kidney transplant, which we talk about quite often on this program?
Yeah, I think distilled down to in its most simple form, we would take Glenda to the OR. First step would be to get her liver out, and then bring the new liver in and sew it in all the places that we need for that liver to be healthy. And so what you really need for an organ is inflow of blood, outflow of blood, and then whatever that organ makes, you have to be able to get it back where it's supposed to go. For in her case, the bile duct needs to be hooked back to the bowel so that you can drain bile into the bowel. The unique thing about the liver is that it has two forms of inflow. It doesn't just have an artery to give oxygen, it has the portal vein, which drains all the abdominal contents back through the liver, and then the liver does what the liver's supposed to with all that. So it makes it a little bit more complicated, and what makes it more challenging than most is when your liver isn't working, you don't clot blood well. You probably have low blood pressure for a lot of years leading up to it, and so it's definitely a challenge for the anesthesia team, and for us, a lot of communication goes on between both teams, and then trying for a good outcome.
So some challenges, some risks during. What about after surgery? What are some of the complications or risks that can happen after?
Yeah, it's kind of, I tell patients, families when we talk to them after the liver transplant that, even though everything went well in the operating room, we got to keep a close eye because liver patients always throw curveballs, and it's usually, it's nothing that the patient themselves did. It's just a very complex operation. All things need to be going right, and so it takes early recognition of complications to be able to salvage those. And so just a lot of good work from nursing in the ICU to nursing on the floor, labs, everybody that's surrounding, a lot of consultant teams, and so it's a lot of people looking after, and recognition of just very subtle things early on can tip you off on no problem.
Well, and Glenda, you did have complications. Your first transplant was 2023. Complications meant that you needed that second transplant. How did you handle that? Well, physically, but then just emotionally, mentally, knowing you're going to have to do this all over again.
Well, I will say my first reaction when I heard that this one wasn't going to pull through, I really didn't even know I was going to have another shot. I never dreamed I would qualify for a second liver so soon. Emotionally or spiritually, I was in a good place. I was okay with that. Physically, I was pretty bad, and ready for some of the suffering to end.
Wanting the suffering to end. What were the complications that led you to need a second one?
Well, the doctors might be able to answer that more. I know that I had a blood clot during surgery. I had one right after, which.
Is that pretty common to have those blood clots?
Thankfully, it's very uncommon. Unfortunately, it's pretty catastrophic when it does occur. And so for Glenda in her first transplant, the issue was that she had a unique situation in that her portal vein that we need to sew to, she had a clot. So when people deal with liver disease for a long time, some of those people lose all the blood flow in their portal vein, and so that worsens their liver disease, and that's usually when they finally get sick enough to where then they need a transplant. So we, in that first transplant, had to open up that vein, but the problem was probably a pretty low flow state, and so the portal vein went down. She had to go back and get the portal vein reopened, and then it wasn't like a switch, oh, she needs retransplanted. It was people trying to salvage that liver for a long time, what seemed like a long time.
Absolutely.
It was, weeks and months.
We gave it an honest effort.
Yeah, and then ultimately what led to additional problems was that later down the line the artery went down, and so it was just a lot of different hits to that liver that was never quite right from the get with the blood flow, and so you have to make a decision at that point. Are you going to retransplant? Or are you going to continue to try to salvage this graft? And she had been very, very sick, and some of that she probably doesn't remember, but I guarantee you Randy and the rest of the family remember.
So how often do you see a case like this where someone not only needs another liver and you go down that route, but then somebody actually qualifies to be able to get another one?
Well, yeah, we don't see it a lot. We do retransplants. Most of the time those are for people that have had transplant a long time ago and they've had some chronic rejection. In Glenda's case, it was more of an acute thing, and so they'll get sick quickly. She got sick pretty quickly, and the liver is arguably more important than anything else in the human body, depending on who you talk to. Luckily, we were the only ones with mics. So you go into multi-organ failure, and so she was in really rough shape in the ICU, pulled through several different times, but when the artery goes down, the bile duct really needs that artery. And so for her, one of the big issues was she kept getting infections in her bile ducts because they had no blood flow. So that helped her qualify a little bit, but she by the time she got her transplant, her MELD score was naturally high enough that she didn't need any exception for that.
Glenda, you shared some photos from your time in the hospital. Recovery, as we can imagine, not easy. Mm-hmm. How slowly did you need to take to recover properly?
Well, with the first transplant, that was kind of decided for me. I mean, I was able to leave the hospital, and I had about a month and a half of good good quality of life. I was trying to get back on my bicycle and feeling pretty good, and then things just started deteriorating, like Dr. King said, infection and then infection after infection. And so that recovery was just really a survival period during that period. The second one was a whole lot different from day one. And the recovery was, I think, as it should have been. And I was feeling much better. Like I said in an earlier interview, you don't know how bad you feel until you feel alive again. And I was desiring to get out and do things before I was probably physically able to. So I was in a much better place.
What's day-to-day life like for you now?
Well, we like to ride our bikes when we
I
can.
know you do. What's that like, getting on the cycle?
Yeah, like I said, I wanted to get out and do it before I was actually able to, so my husband put a motor on my trike. We ride trikes mostly. I ride a bike, but my balance isn't quite what it was, so I haven't gotten back to the bike, but trikes.
But you went on a really cool trip, though, right?
I did. We went to Pennsylvania to ride the Great Allegheny Passage and did a 5-day tour of that.
And that's, Docs, that's got to be pretty cool to see her in some of those photos when you must have remembered her in the hospital at some of those dark days, and then to see her back on the bike with Randy, you know, cycling, doing her thing again, right?
Absolutely, but I always knew she would make it. She had a great heart and always wanted to just get back on with enjoying life, and so I was very confident we would get her through it. It just took a lot of time.
Let's talk about Randy. Does he get emotional a lot usually? Because we saw him get pretty emotional about you. He's a keeper.
He's not normally that emotional, but I found when we talk about my transplant to different people, he's gotten to where he gets a little emotional when he talks about it. He was a rock during that time. Obviously, he was everything to me. He was my nurse. He was my, you know, he made sure I ate. He made sure I took medicine. He was just my overall supervisor. And he stayed strong through all of that. I know that you know about my sister coming. She flew in for both of my transplants, and she was helpful as well. She flew back several times to not really give Randy a break, but just to help Randy and actually be there for him probably as much as for me.
Dr. King, I bet that makes you happy to know that when you send your patients home, that they head home and that they've got a lot of support waiting for them, right?
Yeah, and I think one of the challenges in liver transplant is you got to make sure it takes people once they're out of the hospital. And so for Glenda with Randy and with her sister Gina, I mean there was no question there. And she needed them there, but they needed each other during the time when Glenda was so sick in the ICU, she wasn't able to carry on any conversation or anything, and so the family and who's around her, it was remarkable. And really, from a provider standpoint, coming in and rounding, that lifts your spirits too. You know, everybody's in it together, and there were hard days and hard questions, and the problem with those questions is when you don't have the answer, and so you just work towards the answer, and sometimes those answers you find you don't like, and you got to continue to move through it. And it's a remarkable group of people that took care of Glenda, but nobody more remarkable than her and Randy. It was unbelievable.
That's great. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Glenda, do you have any information on the liver donors?
No, I don't. I wrote a letter to both of my donors, and unfortunately haven't heard anything yet, but I don't intend to give up. I'm going to write some more letters.
What message do you have to say, though, to that gift, those two gifts?
How do you put it into words? I mean, I want them to know there's not a day that goes by that I don't think about their sacrifice and that of their loved one, and pray for them, their families, and the loss that they had to suffer in order for me to receive life like I did, and just thank them immensely.
You're able to spend a lot more time with your son and your grandkids as
Yes.
well?
We have children here locally, but we have our youngest son is in his 5th year of residency in orthopedic surgery up in Iowa City. So he's far away from us, and that little grandbaby, she's our youngest. All our other grandkids are grown. So we get to go see them a little bit more often than we were being able to before.
Good. Grandma's back up and running.
Yes.
Good, good. Dr. King, what advancements in liver transplantation are improving outcomes for patients today, and what do you see coming down in the future?
This is a pretty rapid area of expansion of especially machine perfusion and different strategies to. The pool of organ donors hasn't really increased much over the years. However, the utilization of the available grafts has increased. And so strategies to use older donors that would have been previously turned down, those advancements in really machine perfusion and monitoring of those organs and really some nice advancements by other centers have really proven that older donors can be used, and then different types of donors that previously wouldn't have been used can be used, and then living donation as well. And so I think in Glenda's case, one problem with the type of disease that she had, people that have biliary diseases primarily as their pathology for liver disease, their MELD scores don't always reflect how sick they are, and that's true for several diseases. And so for Glenda, she was very, very sick by the time her MELD score went up. People at centers that are doing more living donor transplants, you can transplant at a lower MELD score before she gets so debilitated and so sick. And so maybe you can get your transplant earlier before you have the complications of lots of ascites or portal vein occlusion like she had. And so I think just making sure that people are aware of all the different strategies that you can take. And so I think it's an exciting time in liver transplant. Liver transplantation is a relatively young field in the grand scheme of medicine. And so I think advancements are happening quite faster than the people are publishing on them. And so going to meetings and listen to people talk about their center's experiences are actually very valuable right now.
Can you talk about the importance of the launch of our Living Liver program here at the health system?
Yeah, I think it's big for our program. It'll help offer people like Glenda and other patients in her shoes who have a bad quality of life. There's no denying it, but there's just no way to get them a transplant. And so if you have a living donor and we can evaluate them, not everybody that comes forward is going to be an appropriate donor for each recipient, but keeping that door open and working through those processes, I think is going to help transplant people before they get so sick, but they still warrant transplant at that time. And so outcomes, I think, will improve, length of stays will improve, time in the ICU, and hopefully complications as well.
Dr. Taylor, for Glenda and patients like her, what medications and lifestyle changes are necessary to keep the new liver up and going and healthy?
Yes, initially you're on a number of new medications immediately after transplant, but amazingly by the time a year after transplant you're only on 1 or 2 new medicines, and primarily these are anti-rejection medicines that you'll take, and that keeps your body's own immune system from attacking the new liver and keeping it healthy.
Glenda, you shared some great photos with us from your care team. Anybody you want to give a special shout out to?
Oh my goodness, if I named one.
You'd have to name them all, but
yes,
give it a shot.
I mean, obviously these two, Dr. Taylor took care of me before transplant and got me to the point where I finally qualified and got me evaluated when he should have. And obviously Dr. King is near and dear to my heart. He was actually involved, I believe, in both of my transplants, but he was the primary surgeon on the second one. All the nurses and therapists and lab technicians and technicians that did scans galore. I guess I would give a special shout out to the angels, the nurses that I call angels on units 63 and 64 who take both the ICU and the step-down unit that take care of all the transplant patients.
They're kind of rock stars, aren't they?
Oh, they're very much, and they all made me feel very loved, very much
thank you for
family.
sharing those photos with
Yes.
us. It's so great to shine a light on those teams. Want to get to some questions from our viewers this morning, and Jean has a question. Do liver transplants require genetic matches like kidney transplants do?
No, you don't have to. The liver is very easy to transplant. You just have to match by blood type and size. Those are the 2 main things.
Stuart wants to know, does Glenda have a ballpark number of how many times you needed to go to the hospital for liver issues before you needed your transplant?
Over the 6 years, starting in 2019, I think we counted 8, maybe 8 hospitalizations up until the fall of 22, when Dr. Taylor said, we need to get you evaluated.
Jeremy has a question. I think it's kidney transplants where you feel much better almost immediately after. How soon after the successful liver transplant do you feel you could tell the difference in starting feeling really good?
Usually patients, even in the first few days, start to feel better. They'll obviously have discomfort from the surgery that they're experiencing, but many patients immediately just feel a weight has been lifted because the liver cleanses a lot of toxins from the body, and so that new liver is immediately removing some of those toxins, and people will start feeling in a different place.
Absolutely.
Amy wants to know, is that true? How soon after did you feel?
Absolutely. I mean, before I left the hospital, I was walking around the unit, walking laps, and I immediately, like I said, from the day one after the surgery, it was so different for me. I just felt alive is the best way I could describe it.
Well, like you said, you didn't know how sick you were until you know how sick you are, right? Yes. Amy wants to know, what factors help a transplanted liver last for as long as possible?
Well, staying healthy, first and foremost, taking your medications. So you have to take your anti-rejection medicine. It seems silly, but that's one of the main causes of problems after transplant. So taking your anti-rejection medicines and then keeping your checkups with your doctor, keeping up with cancer screenings, and just routine things we should all do as part of our health.
And last question, what advice do you have, Dr. Taylor, for someone currently on the transplant list?
You have to keep the faith. So the most important thing I say is rely on your family, friends, and your faith to see that there is light at the end of the tunnel. Keep yourself strong, keep your health up, eat your food, get your exercise, and just keep doing what you need to do and just take it one day at a time.
I like that. Glenda, what do you want the big takeaway to be from your personal story and journey?
Well, I think I want to say if you're considering being a donor, that's a noble thing, and being a live donor, as Dr. King alluded to, allows someone who's very, very sick, maybe doesn't have the MELD score to qualify for a transplant, but is very, very sick. It might be able to help them keep from getting to that stage. And for anyone else, if you would like to become an organ donor, I suggest going to donatelife.net. It's a registry for organ donation, and there's all kinds of information in that resource as well.
Great, thank you so much for sharing your story. Dr. King, what's the big takeaway today?
I think the takeaway is resilience and making sure you have a community around you. I mean, Glenda did so much because she has such great strength, inner strength, but some of that inner strength I think is also coming from external sources because, I mean, Randy, to see him tear up on the video, the guy went through unbelievable suffering in the hospital, helping take care of Glenda when, you know, all of us were amazed by it, but he was a rock then. I would have thought if you're going to see somebody break down at some point, it should have been during all that. So much stress and so much worry, and you know just the unknown. I can't imagine what he went through with that. And so I think just making sure that you've got people that are going to advocate for you, and making sure that it's not going to be necessarily, it's not like a light switch is going on. It's something that has to be carefully observed. After transplant, it's not like, life just going to work out perfect. Life stressors are still there, but you just got to have people that are going to watch you closely and make sure that if something does look a little bit off, you act on it early, and that's your chance to really make a big impact.
I noticed about you, Dr. King, is that you have a lot of compassion for your patients, but you also have a lot of compassion for the spouses and the partners. You've mentioned Randy several times throughout the show, and I really appreciate that about you. I can really tell.
Yeah, I'm from a big family, and I just, when I see Glenda, I see my mom, and when I see Randy, I see my dad, and that's, you're a little younger than what my parents are, so I don't mean to, that's a little, but no, but I gain a sense of community. There's a lot that when you've done a transplant or somebody's having a complication, I mean, you were the one that did the operation, or you were part of the operation, and now you just own that, and you make right by it, and you're not going to always have 100% perfect outcomes, and recognition and letting people know that, hey, this is what's wrong, this is the best way we got to try to fix it. You just have to be honest and open, and I think that I don't like to sugarcoat things, and so when somebody prevails through those really tough times, you're prevailing with them.
Yeah.
It's a very, very, every time I see her, and I see Randy, my heart just skips a beat, if you will. So.
Well, we appreciate that about you. And speaking of moms, we really appreciate Dr. Taylor's mom for watching. She always watches us when Dr. Taylor's on. So we want to say hi to Mrs. Taylor this morning.
She'll love that.
You can say hi to Mom.
Absolutely. Hi, Mom.
Dr. Taylor, wrap us up this morning. What's the big takeaway?
I think there's two things just to highlight here is first recognizing what the gift donors give to our patients, and none of this would happen without people thinking about that and making that ultimate gift of life for people. So that's very important. And I think the second thing we really see today is just how important your care team is, whether that's your spouse, your friend, your neighbor, whoever you rely on to help get through difficult health issues are so critical for success. And I think Glenda's story really highlights that.
Well, thank you all three for being with us today. We appreciate you. Thank you. Thanks to all of our viewers as well. And we'll see you back here tomorrow.
Coming up tomorrow on the Morning Medical Update. From men to women, from older to younger, the cancer statistics are slowly shifting. I'm Jessica Lovell on the next Morning Medical Update. Meet one young woman diagnosed in her early 30s, how her story is already helping other women catch cancer early. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.